Thank you for taking time to join us today for this update on COVID in Calhoun County. It is unfortunate that we're having to have an update now because it's not a good update, but it is important for each person to take this in mind. Today, Calhoun County hit the 200 positive mark of cumulative cases so far in Calhoun County. While we knew this day would come, it has come recently at a more rapid pace than we had believed or had hoped that it would. We've known that COVID exposures and positive cases cannot be stopped for some time. But we do know from our experiences that the spread can be slowed. Unfortunately, in recent weeks in Calhoun County, we've seen some trends that have not been positive. There has been a defined and a continued increase each week over the past month in additional positive cases. Recently, we had the second highest week in a 7-day period of positive cases during that time. And unfortunately, overnight, another death occurred that will likely double the deaths in Calhoun County from the 3 that we had for almost a month now to 4 confirmed and 2 that are probable and are currently being investigated, for a total of 6 deaths, 6 individuals who have likely succumbed to COVID-19 in Calhoun County. These facts come at a time when the state of Alabama is reporting high cases to record numbers. It is a time when we look at the experience in other parts of the state of Alabama and see that in Montgomery County, COVID capacity in their hospitals are full. We see in Jefferson County that UAB Hospital reports all-time high numbers as well. This is concerning and alarming for Calhoun County because we are not immune. While we all realize that life must continue and business must go on, we also know that our experience in Calhoun County, that early recognition, aggressive preparation, and community and individual participation is key to slowing the spread. These implementations and precautions do work against this silent and now deadly disease. During a time with limited movement that we saw a few months ago and people practicing precautions to the fullest, cases, hospitalizations related to COVID, and the severity that those cases were presenting were at a low. That time is gone, though, and much has returned to normal. Recent CDC data showed that Calhoun County has had the lowest per 1,000 cases, the 4th lowest per 1,000 cases in the whole state of Alabama. That's a good place to be and a great place that we hope to remain. But that is to the credit of each individual citizen that has done their part in taking personal responsibility and the precautions that the medical experts tell us that we must take to prevent and to slow the spread and not to catch it. We must each continue to do our best. COVID is a real and still a present danger in our community. It is essential for each of us to do our part. We cannot have short-term recovery without a safe reopening, and we have to continue being diligent and those safety efforts that we put in place many months ago to accomplish this. The Calhoun County Safe Reopening and Short-Term Advisory Council remains available to work with segments of our community to help support them in any way possible. Data this week shows where the majority of those who have contracted COVID in the past couple weeks are between the ages of 25 and 49 years old. Now, what does this tell us? This tells us, obviously, this is our most active group in the community. It's our workforce. It's the lifeblood of our neighborhoods. These are the men and the women who are caregivers to the young as well as to the old who may be more at risk to the effects of COVID. These are the people that we depend on each day. And if they are the ones contracting it at a higher rate than any other group, it stands to reason that the other groups also will contract it. Considering this group has the highest rate of infection is our workforce, our Safe Reopening and Short-Term Advisory Council will look aggressively at additional specific initiatives on how our businesses and industry can be supported to provide for the welfare and the safety of the workforce. We have great relationships through the Chamber of Commerce, through the Economic Development Council, through Alabama Works, through our medical institutions, through RMC's Occupational Health and Wellness, and others who can play a critical role in taking care of our workforce. It was recently said by one of our team members that this virus and the effects of it is the circle of health, and some may say as the circle of life. We are a community, and our decisions matter. Each of those decisions can affect not only ourselves, but those around us. So we have to make smart and safe decisions with the information that we have and that we know. In addition to looking at additional initiatives that we can work with our workplaces, with business, with industry, with local governments, we also today call on the Alabama Department of Public Health to make available to counties throughout the state specific and focused information on trends at the local level. We can take this information, and counties that may have the resources to do so, or the business and industry to do so, can then have a more targeted and focused response to areas or facilities who may be experiencing higher spread at alarming rates. We also continue to call on the ADPH to provide robust contact tracing resources at the county level. As we have said before, contact tracing is critical and is one of the last lines of defenses to preventing community spread. In Calhoun County, our offer still stands to work with our unified command to be able to look at how we can develop and utilize these resources to be able to do our part to prevent the spread. The most effective way to prevent the spread and respond to this danger is not through government alone or the resources provided thereof. It is through individual knowledge and individual responsibility of making informed and smart decisions for ourselves and for our families. The Emergency Management Agency, the Unified Command of Calhoun County, as well as the Safe Reopening and Short-Term Recovery Advisory Council stands ready to help individuals and organizations in any way that we can. We encourage folks to stay informed, and we continue to have a number of ways that they can do that through relative and relevant information updates at calhounema.org, as well as on our social media platforms on Facebook, Twitter, and Instagram. At this time, we'll take any questions that we have from the media that's present today, as well as any of our audience on our social media platforms.
Can you tell us more about the background and kind of demographic information on the patient who died last night and the two that may be confirmed?
That's right. So what limited information I do have on the deaths that are currently being investigated is one of those would have been a death that occurred in the community at their residence, and another one that potentially occurred at one of the hospitals. At this time, I don't have specific demographic information. That'll be for the health department to release, but we are trying to seek that information and work with them so that we can identify and target those areas that may need the appropriate resources.
The person who died at home, had they been diagnosed with COVID-19?
Yes, my understanding is they did have a positive test just a few days prior to their passing away.
You mentioned a need for more data, or the trend data from
That's right.
Public Health. What exactly are you looking for?
So the Alabama Department of Public Health, they have evolved in the amount of data they're able to provide, and we appreciate that. And the example that I gave of the most cases that are being contracted right now in Calhoun County are among that age group of 25 to 49 is data from ADPH. But it's not widely available yet. So we really encourage them to put those mechanisms in place and to do that as soon as possible so that any information is helpful information. In this county, with the Unified Command and the resources that we have, we're willing to put skin in the game, and we have done that to this point. I think that's obvious. So if we just have the data, we can then look at where do we need to put the resources, where do we need to focus on education, on public information, as well as, like I talked about, in our workforces, so we know that that age group is our people that work. And so within that age group, then we know we can help and maybe support. We can go to businesses, we can go to industry and say, all right, we know that the workforces could potentially be the ones most effective if we have that data, and we know that, and we can even narrow it down to facilities. Heavens forbid that we have any issues at our long-term care facilities, our nursing homes, or our assisted livings. But that information is not readily and easily available. It's delayed. And so we need to have that information readily available at a local level and have that good communication in place where we can see that quickly and we can respond to that as fast as we get it to make sure that we're doing all that we can to prevent the spread, to slow the spread in Calhoun County.
You said not readily available. Do you have information on long-term facilities and have there been any cases?
So if you recall, there's a report, I believe, that came out through several different sources where nursing homes, long-term care facilities can input their information, and then it's delayed on it being released. And so we have a historic picture of some of that, but this is important to do in real time because we know it spreads in real time. It's an infectious disease. And so to be able to see that, to become alongside our partners and how we can support them and assist them if they do have an issue is important. ADPH is the hub of all that information, as they should be. We're just calling on them to continue their efforts in working with the counties at the county level, put those measures in place. And we appreciate our region, Northeastern District, and Mary Gomillion and her efforts to be able to assist in that and their staff. But at the state level, we need to have this information available so we can assess it and make local decisions because it's a local problem.
Can retail businesses require customers to wear a mask?
So I'm not aware where retail businesses can require that. They can definitely heavily suggest that, and I would recommend that and fully support that when we're out in groups of people, the governor's recommendations, the safe reopening and the Safer at Home initiative does recommend that. And, a business is private property, and, those owners can have certain regulations that they would put in place. And we know from the health experts that we do wear masks. Everybody has a mask on standing here today. I have mine here under the thing that I put on as we interact after I finish speaking. And so when we go out in public, it's essential that that's one of the precautions we should put in place, as addition to being just distanced from each other. As we stand here today, we're all at least 6 foot apart. And the health experts tell us that's important to be distanced, and it's important to have that face covering. It's important to continue those good hygiene efforts of hand washing and all those type of things. But each of us have to choose to do that at the individual level. The government doesn't need to or have to tell us what to do. We need to make those decisions, and individuals need to be able to make those decisions on their own as what's best for them and what's best for their families. Because, as we said earlier, it's the circle of health. It does affect all of us.
What is your opinion on attending weddings or events? And repeat the question.
So, thank you. So the question is, what is my opinion on attending weddings or events? I'm going to hesitate to give a lot of my opinion, but I'm going to follow back on to what the state public health experts and our medical experts tell us, is that anytime you're attending a large gathering, you need to have these precautions in place. You need to have face covering. You need to make sure that you're at least 6 feet apart. You need to make sure that you're washing your hands and sanitizing things as much as possible. And the folks that provide service at those venues need to have certain precautions in place. And the health order, I think that the state health officer has out there has those recommendations and even requirements for venues to be able to do that.
What are the next steps for Calhoun County if the cases continue to increase?
So the next steps in our county, of course, we talked about an initiative that we can better support maybe our industrial and businesses in the community on how we can do that to keep the workforce safe. If cases do continue to increase, if we have the data where we can look at those targeted areas and where that individually is occurring, then maybe we could put more resources and education into those areas. Until we see what that picture develops, it's hard to say. We do have a number of tools in our toolkit. We have talked for some time about the resources that our medical facilities have. And thankfully, one thing I didn't mention is we're not seeing the high hospitalizations as some of the other counties are. We're still at a very good place as far as that's concerned. However, when we do see those hospitalizations, unfortunately, it does seem to be severe ones as well. But I think we have to look at all those resources collectively and see what we do have available, what the specific problem is, and how we can address it, not necessarily even at a county-wide level, but at more of a community level, a facility level of where are these cases occurring at.
any hot spots in Calhoun County?
So not aware of any one hot spot. That's something that we do hope that we encourage the health department to help us with a little bit on determining that if there is a hot spot to develop, that we would have good communication to be able to see that and respond to that. Thankfully, at this time, I'm not aware of a specific hot spot, but that's one of the things moving forward we do want to look for, and we want to be as laser focused as we can on this so that it's not just a broad shotgun approach, but that it's much more focused to the actual problem. And that's where contact tracing helps with that. If you have, we've talked about contact tracing in this county for many months. If you have effective and robust contact tracing, the experts tell us, then you can identify that problem quickly, and then you can isolate that problem so that you don't have that hot spot that grows outside of the immediate area. Yes, ma'am.
So how are the efforts within the county as far as contact tracing? Do you guys not have enough resources?
So,
Challenges?
right, so the question is, how are we in Calhoun County with contact tracing? Do we not have enough resources? So contact tracing at this point in Alabama is a state responsibility. We did present a proposal back on April the 30th to the state of Alabama, the Alabama Department of Public Health, on how we could utilize local county resources in contact tracing. Unfortunately, they declined that proposal after over a month of consideration of it. While that may not be the exact proposal and it didn't work at the time, we're still open to talking about how can we at this level be able to partner and assist in contact tracing. But right now we're not aware of any initiative by the state to do that. And the state doesn't keep us informed on what their contact tracing efforts are. What we can go on is statements that the state public health officer has made in the past in public events and other interviews with the media where they do need to extend their ability to do contact tracing and they need additional personnel. And our proposal was a response to his plea back in April, on April the 28th, I believe, or 29th, to be able to do more contact tracing.
Someone can't wear a mask due to breathing issues, what do you suggest they do?
So, the question is, if somebody can't wear a mask because of breathing issues, what do they do? Well, that's a decision they're going to have to discuss with their physician. But it's also known that when you don't have a mask on, that the mask prevents you from potentially spreading that to somebody else. And so it's something that person should consider and take those precautions and limit their exposure to other people if they're unable to take the appropriate precautions, when they're out in public.
If you have been exposed, are you required to quarantine for 14 days?
So exposure and infection are two different things. So if you've been exposed, the recommendation is, yes, that you isolate yourself for 14 days until you don't develop symptoms, or you tested and you don't have a positive test. So the best course of action, if you think you've been exposed, contact your primary health provider immediately. Arrange for a test. Testing is widely still available. Go have that test. Isolate for a day or two until you get the results of that test back, and then you either know if you got it or you don't, and you can go back to life as normal.
Will the county recommend other restrictions outside of the state health order?
So in Alabama, counties don't have home rule, nor do they have the ability to put in public health orders, with the exception of Jefferson County and Mobile County. So at the county level in Calhoun County, there will not be any requirements that we can actually put in place that are effective countywide. Again, it goes back to individual responsibility of people, of you and I, to be able to put those measures into place, as well as responsibility on our businesses and our industry to take care of their folks, as they are doing a great job of. We've seen a lot of good best practices, and so those are the things that we encourage to continue, so that we are doing our best to protect ourselves as well as those around us.
What about cities? Jacksonville, Anniston, do they have any kind of ability to impose?
So cities have the ability to put in certain ordinances. I am not aware, though, of any as it relates specifically to public health. That's a question I think that we need to ask the cities about, maybe the Alabama League of Municipalities, and something I need to be better educated on myself. But I'm not aware of that as it relates to public health orders. And again, I'm not advocating for any state guidelines to be put in place. I think at the end of the day, it's a responsibility of individuals to take that initiative to do what's best for themselves and those around them. Any other questions? Well, very good. Well, thank you again for taking time to come today. For those of you that are here, thank you for taking time on social media for tuning in and watching this. It is an important issue. It's an important issue that we see statewide, nationwide, but it seems to be growing increasingly in our state, increasingly in Calhoun County. Our region is still doing very well with that, but the point to take home is that we are not immune, and there's no reason that we shouldn't be like some of the other regions. So that's why we have to take individual responsibility. We have to put these precautions into place and to continue to do our best to stay safe every day. So with that, thank you, and if we can do anything to help, the Unified Command stands ready to do that.